Hello, my name is Janice Murphy and I am a women's health physiotherapist in Cork University Maternity Hospital, part of Ireland's South Women and Infants Directorate. Today I am going to talk to you about your pelvic floor and how to strengthen it postnatal. This is a model of your pelvis. The pelvic floor is made up of layers of muscles and tissues that run from the pubic bone at the front to the tailbone at the back. So the pelvic floor muscles are all the bits in red. The pelvic floor muscles support the bladder, bowel and uterus or the womb, which are all inside the pelvis. They play a vital role in controlling the bladder and bowel, so they keep us dry. They affect how you experience intercourse, and they are also core stability muscles supporting your back and pelvis. During pregnancy, your pelvic floor muscles supported the weight of your baby. So it is really important, whether you're after a C-section or a vaginal delivery, to start your pelvic floor muscle exercises as soon as you are able, usually the day after delivery. The pelvic floor muscle exercises improve blood flow to the area, clear swelling and help the area to heal. So to do the pelvic floor muscle exercises, sit comfortably with your back supported and your feet on the ground. Keep the muscles of your thighs, bottom and tummy nice and relaxed, and breathe normally as you do the exercises. Don't hold your breath. Firstly, as you breathe out, squeeze around or close the back passage as if you are trying to stop yourself from passing wind. Hold 1, 2, 3 and let go. The let go or the release is as important as the squeeze. Secondly, in the same position, you are going to squeeze around the front passage now as if you are trying to stop yourself from passing urine, also on the breath out. This may not feel as strong as the back passage as we have more sensation around the back passage. You're going to hold 1, 2, 3 and let go. For those after a vaginal delivery, this may feel very faint, but this will get stronger and easier as the weeks progress. Now you are going to do them both together, and these are the pelvic floor muscle exercises. As you breathe out, squeeze your back and front passage as if you are trying to stop yourself from passing wind and passing urine. Hold 1, 2, 3 and let go. Remembering the let go is as important as the squeeze. Repeat for 3 to 5 repetitions as you are able, taking about a 4 to 5 second rest between each repetition. You are aiming to progress to do 10 pelvic floor muscle exercises, holding each squeeze for 10 seconds 3 times a day. But this may take you a few weeks or a few months to build up to this. These are what we call the slow pelvic floor muscle exercises. The key is that nobody should know that you are doing them. So if you are lifting up off the chair or excessively pulling in your tummy, you are doing them too hard. Do them to a lesser intensity, and this will isolate the pelvic floor, which is better. The pelvic floor muscle exercises should be pain-free. So if they are sore initially, practice on your side, lying down with the pillow in between your legs until they are comfortable, and then progress to practice them in sitting. When you are comfortable and any stitches that you may have had have healed, you may begin the second type of pelvic floor muscle exercises, which are the fast pelvic floor muscle exercises. If you have had a C-section, you may begin these from the start if you are able. The fast pelvic floor muscle exercises are in the same position. As you breathe out, squeeze your back and your front passage as if you are trying to stop yourself from passing wind and passing urine. Hold for 1 second and let go. These are the fast pelvic floor muscle exercises. You are aiming also to do 10 repetitions and taking about a 4-second rest between each repetition. The goal is to do 10 slow pelvic floor muscle exercises, holding each squeeze for 10 seconds, and 10 fast pelvic floor muscle exercises, holding each squeeze for 1 second, 3 times a day. If you experience any leaking of urine when you cough or sneeze, use what we call the knack. The knack is squeezing the pelvic floor muscles before you cough and sneeze to prevent leaking of urine from the bladder. As I mentioned earlier, the pelvic floor is very important during intercourse. It is recommended not to have intercourse until at least 6 weeks post-delivery to allow for healing and to avoid risk of infection. When you resume sexual intercourse, it is a good idea to use lubricant as you may be drier due to hormonal changes. Once you have healed from your delivery, and if you are still having issues with your bladder, bowel or pain during intercourse, contact your GP and they may refer you for women's health physiotherapy if it is indicated.